Hey, and welcome back to the Sequence Podcast. I'm your host, Dr. Spencer Nadolsky, and I got the lovely, amazing TikTok star and one of our star patients, Samantha Klessinger. Welcome to the podcast, Samantha.
Thank you so much, Dr. Spencer.
Well, I love your TikToks. Before you started this, journey, then you started the TikTok thing, and now you're a much bigger star than I am, and I think you have much more personality and charisma. So I think it's great.
Oh, thanks.
So
I appreciate it.
thanks for being a good advocate for just obesity treatment, weight loss treatment in general, and also being just like cool. So I love your stuff. So thanks for coming on.
Thank you. Thank you for having me. I'm excited.
Yeah, this is the first time we had an actual patient on, and I think it's good to have patients on because everybody kind of comes from a different background, and everybody has a different journey. We say people can fall in different buckets, and kind of similar. Like some people, they struggled for all their life. Some people, something happened, like a death in the family, pandemic, whatever. Sometimes getting married, and people fall in these different buckets, but everybody has their own kind of path of where they go. And so I wanted to get you on because you're one of our star patients, and you're very good on camera and nice to listen to. So
Thank you.
Are you blushing now? I'm just kidding.
I know, a little bit. I'm like,
a little bit.
Start to hurt from smiling so much.
You can feel the heat coming up.
Yes.
All right, and you have a lovely smile. So, all right, tell us, like from the beginning. When did you realize you're struggling with weight? Was it childhood? Was it later in life? I want to hear more about this, and the people listening would like to probably hear.
Definitely. So I think, so for me personally, I struggled with weight my entire life, since kindergarten, even before kindergarten. And I grew up in a household where my parents really didn't teach healthy eating habits, and it was a lot of fend for yourself nights, and there was no education around what I should be eating to help fuel my body with energy. And I turned to food a lot because I lived in a very chaotic environment, a household where there was a lot of disruptions, and I turned to food for comfort. And I think one of the earliest memories of turning to food was when my parents had an argument, and to please my mom, I ate something that she fixed. And so it was kind of like trying to keep the peace between them two. And so I was trying to make the situation better. And so I quickly learned that, hey, food makes me happy when I'm sad. So whenever things are around me that I can't control, that are happening, that are impacting me, let me just go to food so that way I can feel better about myself or better about what's happening. So growing up in that kind of household, that's kind of what started everything. And so both my parents were overweight, sister overweight. Okay. Both my parents had type 2 diabetes, high blood pressure, high cholesterol. Both had open heart surgeries. Like when I was in high school, I remember having to go to the hospital twice because both of them had to go through that whole process, watching them with the recovery of everything, which is very eye-opening to me. And I will say, out of my entire family, I was probably the most active. I played soccer growing up. I was cheerleading in high school. I did weightlifting. And so I really tried to make an effort to prevent what was eventually probably going to come down the pipeline if I continued this path. And getting into adolescence, and, of course, people are not the nicest when it comes to school. No. You have that whole dynamic and pressure of looking a certain way. You had, pop stars back in the day like Britney Spears and Paris Hilton and all of these people that we kind of looked up to that were stick thin. And if we didn't look like that, then something was wrong with us. Yeah. And so getting into college years, you have bad relationships that can affect weight gain as well. And I just tried everything. I remember in high school, I was crying to my mom because I saw a Nutrisystem commercial, and I was like, hey mom, can we please get this? I want to try it out. I went to Weight Watchers. I tried the Atkins diet. I tried the South Beach diet because that was very popular in high school. It was a South Beach diet.
When did you graduate high school?
2007. So okay. I'm aging myself a little bit.
That's okay. So I graduated college in 2007, so you're just a slightly younger. Okay. Younger. That's all right. But the Britney Spears and Paris Hilton, I was like, okay, that's And yeah. Okay. Keep
way
going.
back in
Sorry
the
to
day. Yeah.
interrupt you.
So I think that,
Sorry
yeah,
to
that was
interrupt.
probably like more like junior high, getting into high school. But
Got
yeah,
it.
so just kind of going all about life and trying to figure things out. And I went to multiple doctors to be like, hey, do I have to like type 2 diabetes? Like I wanted to make sure that I especially stayed
Mm-hmm.
on top of that just because the history that my family had, thankfully not diabetic, not pre-diabetic. But I just always felt like, well, what's wrong with me? Is
Yeah.
it my depression? Is it my hypothyroidism? Is it like what is going on to where I can't
Yeah.
lose weight no matter how often I went to the gym, no matter what I eat or didn't eat? And so it just got to a point where I'm like, man, like I'm just like something's wrong with me. I don't know what
Yeah.
it is. And I opened up TikTok one day and it was your TikTok video and you were talking about a new medication, a new GLP-1 medication, and you're talking about sequence. I was like, well, what's sequence? I've never heard of sequence before.
What
I
are
didn't
these people?
Yes,
Who's this
exactly.
quack?
And so I was like running to the TikTok account for sequence and I signed up and I did the questionnaire and I met with my provider. And it was the first time in my entire life where I was like actually being listened to and I
Hmm.
wasn't being like cut off. And I was talking to her about my binge eating because I have suffered from a binge eating disorder practically my entire life. And she's like, you'd be perfect for this GLP-1 medication. Let's talk about it. Let's get you started. And I was like, is it this easy? Like, I didn't have to like fight. I didn't have to like
Yeah.
advocate and advocate and advocate. I was like, okay. And so I gave it a shot. And here I am with
You're like,
Sequence and with you. And it's just, it's an amazing, amazing program that you have that supports obese patients like myself.
well, thank you. Did you ever bring up some of this to a doctor in the past?
Oh, like the binge eating and stuff?
Yeah. Mm-hmm.
Oh, yeah. Yep. So I've seen therapists, I've seen
Okay.
doctors, nutritionists, and even like telling them, hey, I understand that you want me to restrict or want me to cut back, but like I'm telling you, this is going to trigger me. And it was just like in one ear, out the other. Oh, let's just give it a try, or let's try to substitute some meals with shakes. I was like, I
Yeah.
can't do that. I know myself, but they're like, well, let's give it a try. So it's kind of like, well, you're not listening to me. I've even talked to like therapists about my binge eating, and just
Yeah.
nothing has stuck.
Did they give you specific cognitive behavioral therapy for binge eating, or was it just like behavioral therapy general?
So it was a lot of like food journaling and food logs, and seeing what I was eating
Okay.
and trying to adjust from there. Um, I have done you said the cognitive behavior therapy, correct?
Yeah.
CBT.
Yeah. Mm-hmm.
Yeah.
Mm-hmm.
So I've done that before. But yeah, so it's just kind of more like food logs and trying to adjust going from there. But again, nothing. And like also like
Did
exercise logs too. Like, hey, what are you doing for working out? And I think for
yeah.
myself, I get too overwhelmed. It's like now I have
Yeah.
to like physically like weigh everything and write everything down. Like that to me is my trigger as well. So
Yeah, information overload, tedious little focusing on numbers that can trigger. I would say you're normal. The people that do really well with that, they're actually in the minority. Not, I don't like doing that stuff either. What did they ever discuss medicine with you in the past?
yeah. So in college, I was actually on Wellbutrin. I think Wellbutrin had just, no, it was high school. It had just came out. It was newer. And so I was on, I think, Zoloft before then. We switched to Wellbutrin, and it worked very well for me. And even in
Hmm.
college, I started to like lose some weight, but they switched it to generic. And ever since
Hmm.
then, even kind of going
That's
back to
really
the name brand, it's very weird, very weird. But even
that's
going back to the name
interesting.
brand, it doesn't, like, it just stopped working for me. So I
Huh.
tried Wellbutrin, Contrave, Vyvanse, Phentermine.
Okay.
And when I was asking my doctor about Ozempic a few months before finding Sequence,
Mm-hmm.
and she was kind of like apprehensive. She's like, "Oh, well, let's just try this." I think that's when she prescribed me Vyvanse first, and then we'll kind of talk about it. Um, but yeah, so
That's
that's the
interesting. So
medication.
how did the Vyvanse help with the binge eating? It's approved technically for a binge eating disorder,
Yeah,
but
so for me, and she did start me at a lower dosage, keep in mind.
mm-hmm.
For me, I did feel like it helped me focus when it came to my ADHD, but I felt like I was like it's a stimulant, right? So you kind of
Yeah,
feel like
yeah.
you're, what do I need to do? I feel like I need to do something, but I can't do it. I didn't lose any weight on it. I
Yeah.
did notice that it kind of helped suppress the appetite a little bit, but I still had the food voices. I still had the voice of
Okay.
like, let's go downstairs, we're bored, let's graze, let's snack. So that voice never turned off.
Interesting. Yeah. What about the phentermine when you tried that?
Nothing.
Nothing. How did you get it? How
Nothing.
high of a dose did you get?
Oh, I can't. Oh, that
It's
was
like
like
a
a couple weeks ago
37,
for
like a
sure.
normal.
Yeah.
Okay. So yeah, for anybody listening, so phentermine is technically approved for actually short-term weight loss, 12 weeks. When you combine it in with topiramate in a fixed combination dosage in the brand name Qsymia, it is approved for long-term weight loss. These drugs are controlled. We can't, phentermine specifically, not topiramate, so we can't prescribe them via telemedicine due to these laws that are out there, these silly laws. Who needs these laws? But anyway, but Qsymia and phentermine can be effective, but there are many people, like many patients in Samantha's shoes, who have used these medicines in the past and have not gotten the effect that we call it non-responsive. And that doesn't mean you're broken. It just we have these different receptors in our brain. Some people respond, some people don't. So thanks for sharing. That's an interesting thing. So can you describe the binge eating voices that you're kind of these voices in your head a little bit?
Yeah, definitely. So, if I am upset, if I'm happy, if I'm content, like it doesn't matter. It's always that voice that's like, "Hey, let's go see what's in the fridge," or "Hey, you're bored, let's go eat." And even while I'm eating, it's I'm talking to myself of how fast can I eat this plate and how much can I consume in the span of the time that we have at the dinner table. Am I able to go to get a second or third plate? Like if so, let's do it. It's kind of like a competition of, hey, how much can I eat? How full can I get? When it came to family events, I would go into the mindset of, I wonder how much food is going to be there. Is there going to be enough food? Like, I remember at Thanksgiving last year, I looked at it, and mind you, we probably have food enough for like 30, 40 people, and there's only 15 of us. And still, my mind is like, oh my God, there's not enough food here. Like, is there going to be enough food for me? Like, if I'm in a line of people, like, oh, are they going to take all of this? Are they going to take all of that? It was food 100% of the time. I couldn't just stop thinking about it.
When did that start?
I think that started, oh my gosh, I mean, for as long as I can remember, to be
Like
quite,
childhood?
yeah,
Like when
like,
you're, yeah.
oh, 100%. Like, even like growing up at family events, family
Okay.
holidays, all that kind of stuff, I would always like think about what would happen if we ran out of food or if we're going to run out of food. And I think I kind of picked up that habit unconsciously with my mom because she would always just make tons of food. It's like, Mom, why do we have all
Mm.
this food? But for her, she was like, well, I want to make sure everyone has enough and for
Yeah.
leftovers and this and that. So it's kind of like you're picking up on those habits that your parents, kind of unconsciously give you as well.
It's interesting. Do you think with, so this is controversial. I mean, you wouldn't be able to know for sure, but like you mentioned education and kind of the nurturing part. Do you think it would have made a big difference if your parents tried to have certain foods and around the house and whatever? Do you think that would have made a big difference?
Yeah, I think it's not having their support in what I was trying to accomplish. Because
Mm.
I would legit have conversations with my mom and dad saying, "Hey, like I'm trying to lose the weight. Can we avoid bringing chips in or the junk
Yeah.
food? Or if you do, like is there a place that you can hide it because if I see it, I know that
Yeah.
it's there and if I get triggered, I'm going and I'm going to just go ham on all the junk food." And it was kind
Yeah.
of like, "Oh yeah, yeah, yeah," but they never listened. They would bring it in
Mm.
and it was just game over. And I'm actually, I mean, working with my husband with our kids of, trying to talk about protein and
Yeah.
different fruits and vegetables and how they correlate with our bodies and like what they do for us. And so if Evelyn eats a carrot, she says like, "Hey, Mom, carrot's really good for our eyes." I'm like, "Yeah, it is. Isn't that awesome?" And try to kind of not like force them to eat
Yeah.
by any means, but just trying to do a little bit of education as they're eating and talking about, hey, this gives us great energy so we can play with our
Yeah.
friends and we can learn about penguins in school, all that kind of stuff.
That's
So
great.
I think I'm trying to break that cycle
Yeah.
moving forward with our family. Just because, again, I want them to have the education because I feel like that's what I missed out on. And I think it could have made a difference.
That's great. And then when you started the GLP-1 medicines, what did it feel like?
You're gonna make me get emotional in here.
We love emotion here on the Sequence
No, I
podcast.
know. So I remember it was like day 2 after the injection, and I was like, hold on, like I should be thinking about something. And I felt very kind of uncomfortable. I was like, wait a minute, like what's going on? What's happening? And I realized that I wasn't thinking about food. And I was like, oh my God, this is what it's like to be normal, like to not worry about food or, it was just
Yeah.
a so very surreal moment for me and a very just much like I could like breathe finally. I could finally
Yeah.
just relax and not have to worry about it. And so it impacted me a lot. Sorry.
No, that's okay. No, it's great. I think no, it's good to show that raw emotion. There are people out there. If I had, by the way, if I had Kleenexes I would be giving them to you in
No,
a
it's okay. I
room.
was like,
But
babe,
we're
my
in.
hands.
That's what you're supposed to. It's a bedside manner thing. You give the Kleenex box. Anyway, so no, it's good to show that because there are people out there that are like, I just don't understand why can't people just stop eating? And it's like. It's like a scratch, an itch you got to scratch, and you can try to ignore it for a while, but it gets stronger and stronger. And some people, maybe it will go away after a while, but other people, it just keeps stronger. And if it's just there all the time, you're gonna eventually, scratch that itch. I mean, there's probably other analogies you could probably come up with better because you're the one experiencing it.
Mm-hmm.
But this is kind of what my patients describe. And so, obviously, if people are listening to this and watching this, they're probably in the same boat, but there may be people that don't really understand. They don't have the true like empathy. I think you just showed it right there. It's like, I want to do these things, you idiots. I'm not just like, gluttonous type of thing. These are true physiological. There's obviously psychological stuff, but it's physiological drivers
Right.
combined with the environment. So, when you're younger, you couldn't control the environment. Unfortunately, you tried your best. And now we have this environment, and yeah, you can try to do your best at making your household your own environment, but like still those signals from your brain are kind of like you explained it better than I could ever explain it. So you started on that and you felt this kind of like relief and kind of took the edge off. And it sounds like some people think it takes the edge off. For you, it sounded like it was just a complete, like almost normalization of your appetite and signals. Does that sound about right?
100%. 100%.
And so instead of like getting those voices, what did you do then? You were just kind of like, what did you eat?
So with this medication, I was actually able to look at my refrigerator and not go to the food that I shouldn't be eating. Like I was able to go pick grapes as a snack, make myself a healthier sandwich, or actually want to make some chicken with some vegetables for lunch rather than a bag of chips or a bag of popcorn out of the microwave or, just not eat. And so for me, I felt like it was easier for me to make healthier decisions because I didn't have the voices that were like, let's just eat whatever we want. And so for me, that was huge as well. Like it's easier for me to make those healthier choices.
Yeah. So I always say this, like, I think pretty much people know that like, hey, a bag of chips is probably not as good as maybe the apple or broccoli. Like,
Right.
it doesn't take much to figure that out. But like, if you're just like have that. I mean, we all know cravings and whatever, and yours sound like very, very strong. And so you're able, it kind of took the edge off to do those things. And then tell us about like when did you start? How many months ago?
So I started July 22nd. That was my first injection.
So six and a half months ago.
Yeah.
And and then you've escalated your dose, and you've noticed that the dosage helps, and now are you on the highest dose of
So I'm
the
on,
medicine?
not the highest dose, the
Yeah,
the uh,
the one right below.
the one right below it. Yeah.
Okay. Okay. So yeah, so for anybody listening, some people people respond differently to these various GLP-1s. Sometimes the lowest dose. Some people don't feel anything. Some people sometimes get sick. Did you ever have side effects? A little bit of, I think you mentioned some nausea a little bit.
So for my side effects, I've had like very minimal side effects, and they've
That's
been
great.
super manageable. So no nausea, no vomiting, even like no diarrhea, really. Just
Yeah,
like
good.
slower bowel movements, some indigestion at some points, but again, super manageable.
That's amazing. That's awesome. So yeah, some people don't even feel anything, and then they escalate their dose, and it sounds like you responded very well. That's what we love to hear.
Yes.
I don't know if you're a hyper responder. I would say like you're just a good responder with no side effects. That's amazing. Some people do have side effects, and then we keep them. We have a whole podcast on that. We keep them on the lowest dose. Oh, I love to hear that you did so well with this and you responded well. And like, you lift weights. You used to be a big athlete back in high school. You were weightlifting, cheerleading, and what else were you doing?
I did soccer too.
Soccer. Okay. And you're getting back into some of the fitness things you'd messaged me before. Or
Slowly,
how
yes.
is that going?
Being
That's
full
okay.
transparent,
That's all
slowly,
right.
yes.
That's all right. That's okay. Do you feel did you feel like the weight, like losing some of this weight help with feeling more active or energy, like anything like that?
So energy wise, yes. I feel like I mean, I have stopped taking other medications because I have the energy. I feel better. I just like mentally, it's very night and day. And, I did have to be cautious starting to weightlift again because I noticed since I wasn't consuming as many calories, I couldn't go as hard as I wanted to, like
Yeah.
how hard I normally was. Because like afterwards, I was like kind of lightheaded, so I kind of had
Yeah.
to just really kind of watch what I was doing. But for sure, energy has played a huge part in me wanting to be more active and even just like going up the stairs. Like I can go up the
Yeah.
stairs a lot easier and faster than I used to. I'm not like huffing and puffing when I get off of the stairs and everything. So those changes are great.
Have you noticed any other health effect? Did you get blood work that showed any changes or anything? I don't even know if you had any issues in your blood work in the past, but anything
Yep.
there?
So when it came to my A1C levels and my glucose levels, those are actually improving. Even though I was never I'm not in pre-diabetic, but
Yeah.
they went down a little bit. Also high blood pressure. So I've had
Okay.
like some testing here and there where my blood pressure has been elevated, but this last time overall it went down, which was great
That's
too. So
great.
I am seeing those improvements as
That's
well.
awesome.
Yeah,
So in 6 or so months, how much weight have you lost so far?
42.8 pounds so
42.8
far.
pounds.
Yeah.
And in the past, had you ever been able to lose that much weight okay.
No, so the last time I was able to lose weight it was 35 and a half pounds, and I was doing a 75 hard challenge and only eating like carnivore. It
Carnivore,
was
basically
intense.
meat. Meat and eggs, maybe?
Yeah, so meat, eggs, cheese,
Cheese.
no fruits, no vegetables, no breads. It was a very intense time. But just to go to show you that yes, short term, lost 35 and a half pounds in 75 days, but I gained that plus an additional 60 pounds.
Wow.
Like
Okay.
I almost gained like 100 pounds in like a year and a half after that.
Yeah, and that's a common story that we hear, not necessarily with that program, but just with any type
With any
of
program. Yeah.
program. And it can even be like a well thought out, you know, nutrition program. Doesn't mean you shouldn't try it. It just means that they work for, I would say, the minority of people. Do you still eat like dessert and stuff like that now, like stuff that you would enjoy before, just more once in a while, or how do you do that?
Yeah. So one thing that going into this journey and still to this day is I just don't want to restrict myself. I don't want
Yeah.
to put the added pressure on myself like I did in the past. And again, just because of the past history of binge eating, I really wanted to go into this of like, hey, if I want a cookie, I will have it. And it's surprising because I will have a cookie, but I'll have like 2 bites instead of the whole thing, and I'm satisfied. I'm like, I don't want it. And there are some times where I'm even kind of, I think I want something sweet, but when I really think about it, I'm like, no, I'm good. So I feel like it's easier to make those decisions as well, as far as like really kind of stopping and thinking, do I really want this, or is it something that's trying to come back in of like, hey, we should probably eat this. But it's way easier to say, no, I'm okay. So
Yeah,
I still have pizza. We had pizza the other night. I have like one
it's
slice
amazing.
instead of like 5 or 6 or 7. So,
Yeah. What's your favorite brand? Do you get us? What do you get?
oh no, favorite pizza? Oh, it
Yeah.
depends. So, I mean, from Chicago area. And
Oh,
so if I really want like a true authentic Chicago style deep dish stuffed pizza, Giordano's. But if I want like something quick and easy, it's like Pizza Hut or like a local
yeah.
chain. So,
Got it.
I don't know.
Pizza Hut. Yeah,
Yeah,
that's
it
my
just
daughter.
depends.
I like Papa John's. Pizza Hut's. Yeah, there's some. I actually like the ones with like the wood brick oven or whatever they do, and they make it right there and quick and throw it in, pull it out.
Oh yeah, I think like
That's
mod pizza is one of them.
yeah. All right. So what are some other like non-scale victories like that have nothing to do with the number on the scale? Anything
Yep.
like that?
Yeah, so this most recent one, I had to get a new work blazer, and because the one in my closet, I'm legit like swimming in, and so I went to go pick one up, and I went from a size 26 blazer down to a size 20 blazer.
Oh wow.
And other non-skill victories is just, I think for sure, being more confident in my body and in my skin. Like I'm gaining more confidence. Definitely, like I said, when it comes to like walking up and down the stairs, or wanting to play with my kids and having the
Yeah.
energy to play with them and keep up with them, I think that is super huge and a great non-skill victory. But yeah, I've definitely celebrated a lot of them. So
You deserve a whole new wardrobe, and I hope even in another 6 months or so, another wardrobe,
I know,
and then
and
you should
that's
just
right. That's the
that
only
should be
thing. I'm
your
like,
next TikTok
I can't
thing.
do too much shopping because first off, my bank account would not appreciate that, and second off, like I don't know how long I'm gonna stay in these clothes. But yes, I'm slowly getting out some of the old clothes. I think that's another great non-skill victory is actually being able to go into your closet and pull things out, not because they're too small, but because they're too big. And
Yeah.
so you have to like take all those out and like donate them. So that's pretty cool.
We should get you a deal with TikTok being an influencer for one of these like designer boxes, subscription clothing
There you
boxes. Let's do it.
go.
I'm gonna campaign for
Help a
Samantha.
girl out.
Let's get her some clothes every few months. New set of clothes from one. I don't even want to mention names because there's a bunch of different places out there that. But you could we could probably get you a deal. I love
Absolutely.
it. That's awesome. Anything else? Anything else about your journey? You've kind of discussed it. Like it's perfect. It's a perfect story to kind of explain what people are going through out there.
Yeah.
But
No, I
anything
just
else
want
that
to,
sticks out?
yeah. No, I just want to, thank you and everyone at Sequence. I know, especially kind of going through how big Sequence has gotten, which is fantastic. And I just want to thank all of you for your support and for your advocacy for us and what you do every single day to make all of your patients successful in their journey, whatever that journey looks like to them, and to actually have the support behind it. So it's not just the provider, but it's like the nutrition aspect, the fitness aspect. Because I think that truly sets kind of you guys apart from other places, other doctors' offices, whatever it is. So I just want to say thank you for that.
No, thank you. That is our goal, and we're going to probably brainstorm with you more on how to even improve it to be even better. That is the absolute goal. Thank you so much for coming on. I'll probably have you on at some point. We'll do a round table with other people, but
Absolutely.
thank you.
Yeah, thank you so much. I appreciate it.